very well known with what Joanne's doing. Hey, Joanne, good morning.
Hi, Joanne.
Good morning. Wow, wow, wow. I wish I had signed up for if it could have started at 8:30 before any of these superstars. They have been amazing.
You're a superstar.
It's been terrific.
Well, it's nice to see you. And I mean, again, you've been here since the beginning of our very first one. It's always a pleasure to have you. I know you're doing such great work. And yeah, we want to certainly give you as much time as possible to share with everybody, what you're doing, the importance of all of this. So, it's good to have you back, Joanne.
Thank you very much. Are you saying I'm getting old?
No.
Yeah.
No, we're all experienced, right? That's the term of the day. We're more experienced and wiser.
Chronologically enriched. You've probably heard me say it before, but I have a very, very, very important announcement, and I want your viewers to make sure they listen carefully to this question. If you are not sexually active, tune out now. Okay, that's what I want to start with. I want to continue what Emmy started this morning, very, very early, the sex talk. And all kidding aside, but often in lectures, I will start with that question. It's really funny because I guess my voice must resonate out into the hallway. But as soon as I ask that question, it's like people start filtering into the hallway faster and faster and faster because they want to hear about this. One poor chap that was lecturing about endodontics. I think it was Utah Dental Association meeting a few years ago. And he said, man, I was just glad I had anybody in my room after I heard what you were talking about. But all kidding aside, it is a subject, a lot of my focus is on HPV associated oral pharyngeal cancer, back of the mouth, the throat, those particular anatomical areas. And there absolutely is no stigma whatsoever. I do want to share a personal story with you. But first of all, I want to thank all of you because I'm sure this will resonate deeply with each of you. Knowledge translation is not a particularly difficult task, but what is really challenging sometimes is emotional translation. Do you guys agree with that?
Yep, absolutely.
And I look at Amber's story just resonates so far and wide with people that haven't experienced this themselves. And that's really the difficult piece. And I wish, I often say, I wish I could take each and every audience member with me to hear the stories about what oral cancer survivors and those, unfortunately, that have lost their lives, what they have gone through. It's not only the diagnosis and the disease, but it's the darn treatment that any oncologist will tell you is one of the most challenging areas to provide treatment to, especially, as far as radiation is concerned. So I know you've got an outstanding lineup today. You've already had, 3 outstanding speakers along with Linda's introduction this morning. But one of the stories that has resonated really strongly with me over the last few months, she's now become a treasured friend, is Dr. Peril Dua Makar, who I believe is speaking, is at 1:30?
Mm-hmm.
She's coming.
Yes.
Mm-hmm. And Amber, you and I had the distinct pleasure and honor of working together with her. But her story about her brother's passing, I can guarantee you, and there's not many things in life we can guarantee these days, but I can guarantee you that is a story that will definitely stick with you. So I look forward to being able to hear her story once again. And I believe she is coming, if I'm not mistaken, from some lovely tropical place, not Snow Valley, where I happen to be, where we have had snowfalls twice this week.
Well, we actually, Joanne, pre-recorded Peril's story because she's taking her trip that she had planned as a family with her brother for this day and was going to be traveling. So
yes,
she'll share with us virtually.
Okay, well, kudos to her for being in Hawaii, I believe it is, with her family in memory of her beautiful brother. My message today, though, is, I listened to the speakers prior to me and I thought, man, there is so much congruency here. And none of us are being paid to say this. It's just experience is a great, great teacher. And if you get to this age in life where the gray hair comes in, of course, that hasn't happened to me. This is all very natural. But when the gray hair, what's everybody laughing at?
I think it's beautiful.
Yeah, looks good.
But-
Yeah, natural look.
Gray hair looks great on you, John. Lovely.
He can pull it off.
That's the unfair male advantage in this world. Men get distinguished, women grow older. However, on a very sobering side of it, what I want to talk about is putting our best foot forward. And I also want to talk about the reality of clinical practice. I have been over 4 decades. I started practicing when I was 8 years old. I know it's a very old joke. I'm going to say it really fast because it's not even really that funny anymore. But I started at a really young age, not that young. But anyway, into 4 decades, so many things have changed. Years ago, like when the older gentleman came in, veiled in a puff of tobacco smoke, smelling of alcohol, that was my chance to really do a good oral cancer screening. Because I thought, oh, he's at risk. That gentleman, I've got to be really careful with. And age is a factor. Definitely, definitely. As we just heard from the geriatric tooth fairy, that's so true. However, nowadays, the fastest growing segment is related to a common virus, a virus that's so common that almost every sexually active adult will have it. And that, of course, as we know it, is the human papillomavirus, or HPV. So what can we as a dental professional do? So before we talk about AIDS and things to help us, let's talk about what we're doing with our eyes, what we're doing with our hands, what we're doing with our sense of feeling and touching. So let me make this really, really clear. If you are not wearing, and I've always got my loops close by, if you are not using magnification is one thing. This is my Spark, which is the illuminated headlight. This was the first wireless headlight. It fits on virtually any loop, bi-oroscopic. If you're not wearing loops, you are going to miss things, especially red lesions. And red lesions, red flag. Those are very subtle changes in texture, color, different aspects in the oral cavity. So we're not talking about HPV yet and that posterior presence. We're talking about what's up front in the mouth in those dangerous areas, the triangle of death. Not probably what you want to say to your patient on Monday morning. You don't want to call it the triangle of death, but it's that palatal area, the anterior portion of the tongue, and the floor of the mouth. Those are the dangerous areas. So you not only want to, excuse me just for a second here, let me just grab a tissue, which I have close by. You not only want to, you not only want to look, you want to feel. And I find that that's sometimes the missing component, that yes, we'll have our patients stick out their tongue, we'll look at it, but if we're not compressing it all the way down, we're darned as positive going to miss certain things that are starting. Now, that's what's on the surface. So looking is very, very important with magnification. Feeling is very, very important. But what about the virus that affects the posterior areas? I don't think with any hope we're going to be able to see the posterior base of the tongue, like what Michael Douglas had, a walnut-sized tumor at the posterior base of the tongue. Nobody saw that. Even with a laryngoscope, sometimes that can be missed. What is so important is good palpation of the head and neck. And if you actually go to the Velscope website, there's going to be some videos that will be released that walk through that palpation. But making sure that we really check the submandibular, the cervical nodes, the supraclavicular, those are critical areas to make sure that we palpate, because those are related to the first visible sign. And at that point too, we've got to remember that we've already got to lymph node progression. The other thing that I wanted to say as well, And I understand that we might be sharing that video later in the recording. So that is absolutely awesome. Kudos to you guys. You're just so on the ball here. What a valuable day of learning. The next thing that I did want to share, and I guess, again, here we go with that age factor. I'm getting too old to water down my message. I'm going to tell you right now, people, if you're not using an adjunctive screening device, you're also going to miss things. I do work with Velscope. I'm proud to say I do. I'm not being paid for today to do what I'm doing, but I do want to say I work with Velscope. I approach them because when I looked at the science and I understood that this was a platform that was used in the cervix and the lungs and the colon and had very, very strong science behind it, and the mucosal differences were very subtle, if any, I thought, wow, this is something that actually penetrates below the surface where abnormal cells start. Why would we not be using this? Why would we not want to give every person that sits in our dental chair, I'm sure we regard them and respect them as a fellow human being. Why would we not want to give them best possible opportunity? So the other thing I did want to share is, if we start doing things that are different, and you've already heard, some similar messages here that may actually change, and that's amazing. Your investment of time was worthwhile today. If you're going to take something into practice Monday morning that might be a change in the way you do things, that is absolutely awesome. Your time is being well spent. But how do we take something like Velscope, which I happen to have right here? It shines a safe blue light. There's no radiation. The examination takes about 1 to 2 minutes to do. It's very, very quick. How do we actually introduce that to the patient? Simple. Let's pretend. Let's do a little bit of role playing here. Say we had a patient in our chair. We just completed their head and neck examination. So Amber, we've completed your head and neck examination and your oral cancer screening. Now we're going to use Velscope to look beneath the surface. And why do we use this? Because typically abnormal cells will start beneath the surface. So we want to give you every best possible chance to discover changes as early as possible. So we're going to use Velscope. As I said, it's a painless exam. It's a safe blue light. It takes 1 to 2 minutes. There's no radiation involved. And, depending on your practice, you may choose, as somebody quoted earlier, $20 for the examination. You may want to do it for free. You may want to do it for free the first time and then give them the option after that. There's one of the fastest returns on investment with this particular device. So it's up to you how you position it. And last but not least, because I'm looking at my time and I know there's some amazing people coming in after me, so I don't want to overstep my limit. But the last thing that I want to say is between professional visits, this is another thing we can do to up our game and to make sure that we're putting our best foot forward. Have your patients check their mouth in between visits. Checkyourmouth.org. That's my baby. That's a pet project that I played a lead role in between the Oral Cancer Foundation and ThroatScope. And if you go to checkyourmouth.org, there's a video and it shows step-by-step how to go through the exam. So that is my message. Oral cancer screening saves lives. Look at every patient as if a life may depend on it, because it may just. Thank you so, so much.
I love that, Joanne. Checkyourmouth.org. There's the element we talk about, the dental practices, making sure that they're doing what they need to do. Like you talked about the screenings, always responsibility on us as patients, right? And so if the dental teams at the very least can remind all of us to be able to do that, definitely makes a difference. So love it.
Yeah, thank you, Joanne. Amazing message.
My absolute pleasure. I appreciate any time that I can share this message, and especially with an organization like yourself that is doing so much to improve lives. Thank you.